There's so many different realms of physical therapy. There's neuro rehab, there's inpatient, there's outpatient physical therapy, orthopedics. There's so many pediatrics. So I specifically do orthopedics, but there's also specialized in breast cancer specifically and lymphedema care as well. So I am not specifically specialized in either of those, but I have seen a lot of patients with both lymphedema and post-op mastectomy, lumpectomy, radiation, and all of that. So I'll share a little bit of some of my experience and some of the research that I've done too. And my main goal is to help you guys out. So if you have any questions along the way, feel free to share. And I'll have a section for questions at the end. So if you want to wait till the end and want to talk more personally, I can stop the recording and we can talk there. But for now, we will go through this. So my main asterisk is always talk to your doctor prior to beginning physical therapy. So there's so many different stages. For instance, if you still have the drainage pump and all of that, sometimes your doctor doesn't want you to begin any movement with your arm without being confirmed by the doctor. So just in general, always talk to your doctor prior to beginning any physical therapy or any movement of your upper body after surgery. So since you guys are familiar with physical therapy, hello, Diana. So some of the things that physical therapists do, and every physical therapist is different that you'll go to. But some things that I like to focus on is there's always a manual therapy component. So a lot of hands-on work. And I find that really helps patients really open up and kind of help them relax their muscles so that we can really dive deep and get some range of motion back. There's also therapeutic exercise, which can be strengthening, range of motion, neuromuscular re-education. So retraining the muscles how to work when they've been atrophied, whether it's after a surgery or anything like that. And then lymphatic drainage. So for specifically with lymphedema. So some of you may already know this as well, but some of the most common effects of breast cancer treatments are pain, lymphedema, fatigue, decreased shoulder and neck mobility or range of motion. And then there's the psychosocial aspect. So many of you may have experienced this before or have somebody in mind that you're thinking of with these kinds of effects after breast cancer treatment, such as surgery or anything. So, and these can take a toll on every single aspect of your life: depression, anxiety, stress. And I'm here to tell you that just getting movement and all of that can actually increase your endorphins and improve some of the psychosocial effects after some treatments like this. So how can physical therapy help? So generally improving joint function. So we kind of talked about earlier, like shoulder range of motion, strength, overall mobility, and overall improving your pain levels, as well as returning to everyday tasks with reduced fatigue. So just being able to unload the dishwasher without just having to sit down and take breaks can be a huge goal that some people have. And all of these things the physical therapy can help with to help you meet those goals. And then kind of improving your overall mood with those endorphins and therefore increasing your quality of life. So many of you may know this again, but American Cancer Society recommends specifically around at least 150 minutes of moderate exercise a week or 75 minutes of vigorous activity weekly. And I was kind of looking at this. This is compared to the American College of Sports Medicine. Both of those kind of go hand in hand with the American Cancer Society. So they do recommend after that time that you're cleared by your doctor to go ahead and get back to moving at least 150 minutes, which seems like a lot, and it is. But if you take maybe 10 minutes between meetings at work or 10 minutes at the end of your day to just do a little walk is movement. That's some moderate exercise. So just incorporating any of that into your daily life can help with some swelling, the inflammation you get after surgery. And again, I might be preaching to the choir, but I do just wanted to mention this is something that the American Cancer Society does recommend. Resistance training and stretching at least twice a week for both of those. So And as the first slide or first bullet says, start slow and progress to more intense activity as tolerated. So you don't want to start right away with 150 minutes or resistance training twice a week and stretching twice a week, but you want to increase that into your daily activities or weekly activities. Start with once a week, once every other week, just to see how it feels. My main goals are to make sure that nothing you do increases any pain. So I'm not about the no pain, no gain policy. Sarah might tell you otherwise, but I am all about I do not believe in the no pain, no gain policy. So if something is painful, generally it's not kind of helping meet that goal. All right, so we kind of mentioned earlier, but where do I begin? So I just wrote Google the closest PT to you. So you want something that's convenient. I understand you all probably have many appointments throughout your week, and the last thing you want to do is schedule 5 appointments for physical therapy in the next few weeks that are 45 minutes away. So you want to be able to have something close by, can work with your schedule, and kind of work with your goals too. We mentioned also ask your doctor for recommendations. So you said, Rosalind, that your surgeon's out of town. So you did a great thing by talking to Levine Cancer Institute to ask who they would recommend for therapy or who they recommend in this area. And I think that's really smart. So ask you any other doctors that you've seen here, not even just your surgeon. They all have physical therapists that they recommend to. And then if you don't have time for a visit, some doctors even give you a few exercises that they recommend early post-op or later on, just depending. Sometimes they give you like a paper of like 4 or 5 exercises. And I just incorporate that just one a day and see how it feels. So it's not an all like go in hard, just kind of give yourself some grace and kind of ease into it slowly. All right, so there's obviously different stages of recovery. Most of the time you hear of PT after surgery, but actually there's a pretty important part pre-surgery that physical therapists can take part in your recovery. So basically something that you can see a physical therapist for if you are scheduled for surgery coming up. You can talk to them about kind of what to prepare for, how to prepare your shoulder and neck range of motion and strength to kind of have a more optimal outcome after surgery so that you might not be as sore, might not be as swollen. So that's also another thing. Also, main thing is education. So just sometimes physical therapists can be another person to talk to. Most doctors are in their rooms for, I don't know, 10, 15, 20 minutes. A physical therapist can sit down with you and talk for anywhere 40 minutes to about an hour, depending on how long their appointments are. And I find that that's something that just kind of helps ease people's minds, just to kind of know, okay, this is what to expect. And you can always talk to your friends and anyone at the Pink House too who has experience. That's always helpful as well. And then early post-operative care. So right after surgery, usually doctors don't recommend until after that first month post-op. So usually, 4 to 5 weeks later. So you want to start some early mobility and maintenance of incisions, swelling, and then range of motion. So I want to make this smaller. Oh, there we go. So that being said, I'll show you some videos of exercises coming up here that are some good early mobility exercises to like add in light range of motion. All right, and then we have the later phase of post-operative care. So usually 3 to 4 months after, sometimes it can be longer, 4 to 6 months, you can really start strengthening. And typically, and I know, Rosalind, you said you already have some lymphedema symptoms and everything. So typically it comes on around anywhere from like 1 month to like 3 to 4 months is where you can start seeing the early signs of that. So typically around that later phase of post-op care, anywhere from that 3 to 4 months, people will start working on that management of lymphedema, or if they're already starting it earlier, they will start that physical therapy for that earlier. And then last is long-term care continuum. So returning to your activity, whether it's walking, running, doing yoga, swimming, anything like that, and maintaining that strength and function for daily activities, because everybody has this cycle that, you know, ebbs and flows. You have more fatigue one month, radiation causes more fatigue. You kind of move through this cycle. So having that long-term care and kind of a maintenance program can really help. And usually physical therapy, what they'll do is help you get to that discharge point, usually between that later post-op care and then the long-term time, and then give you an exercise program to kind of maintain what you've gained there. So that's a good goal, to find a good physical therapist to help you with that. All right. So speaking of goals, here are some specific goals that some people have that are breast cancer survivors. So the main goal or main thing to note when you're looking for a physical therapist, you want to help find somebody that will treat you based on your personal goals. Everybody wants to be able to reach over their head, but your goal might be to be able to lift heavier weights, return to the gym, or be able to lift and carry your groceries without stopping because it's heavy or painful or you're really tired. And just making sure to know that your goals can change too. 1 week to the next, everybody's goals can change, whether it's to wash your back, reach in the kitchen cabinets at the top just to reach your plates. And then most people's are be pain-free. So that's generally a common one for most people, but just note that your goals may change, and finding a physical therapist that can help you kind of create some good goals or help you meet them is what you want to find. All right, so this is the part where I have a couple videos of my coworker Rachel doing some of these exercises through these different phases here. So we have the early post-op. So these are the ones that you can start doing about 1 month to 2 months after surgery, of course, after you're cleared by your surgeon. I think this is going to work. Okay, so these are just some table slides. You're going to go forward and then backwards. So this main goal is just to kind of go to where you feel that kind of pull on your underarm and your armpit area, or even at the top. Again, you don't want any pinching or pain with these, but you want to just go to tolerance and then right back to it. So another one in that same position, there we go, are the side slides. So these are getting that motion out to the side. So just sliding and letting your arm kind of slide on a soft surface is the main thing. You don't want it to be super hard for your arm to move like that. All right, and then down in the bottom left here, Rachel is doing some overhead range of motion exercises. So you can grab a stick or a cane or yardstick, like anything that you have. And your unaffected arm is going to be doing most of the movement. So she's doing most of the movement, I think, with her right arm there, and her left arm is kind of along for the ride. So this is a good one when you feel like your strength is you're just not strong, and your arm is a little bit more fatigued quicker, specifically the more affected arms. So you want that, the stronger arm to kind of do most of the movement for you. So it can help you get that range of motion. The goal with most of these is range of motion, not so much strengthening. Usually strengthening, like we were saying, comes a little bit later. And the last one here are some shoulder blade squeezes. So I think you said, Rosalind, sometimes you feel like your shoulders are coming forward. So this is a really good one. You want to squeeze those shoulder blades back and down. So you're kind of bringing those down into the opposite back pockets. A lot of times people come here, and a lot of times this is where most people hold their stress. Women in particular, this is the most common place I see. So we don't want this to happen because we've already got enough stress up there. We want to pull it down and back to pull those shoulders blades back. And I'll show that one again. This is probably one of my most favorite exercises for early post-op, to just, especially if you've got the drains and everything in the front, it's pulling you forward more so. Any questions about these specific exercises before I move on? You guys good? Okay, good. So these are a couple other early ones. These are both pec stretches. So these are very light pec stretches that shouldn't be feeling like they're pulling intensely. You don't want to feel like you're pulling on a taut band. Also, another thing to note with some of these, I would make sure you're warmed up, whether it's, taking a warm shower or just going for a light walk before these exercises so your blood flow is working. And then incorporate some of these range of motion exercises so that you're not doing it on a cold muscle. So this one, I think I pulled, there it is. She is laying on a foam roller. If you don't have a foam roller, you can roll up a beach towel and put it between your shoulder blades, and you're going to sit on the bottom part with your hips there. And she's just resting with her elbows by her side. This is a very light stretch for that pec area. In some ways, to make it a little bit more difficult, is bring those elbows up or arms by your side here, or arms extended out like a T. This really gets that pull from your sternum out. So this one might be a little intense with your arms straight right off the bat, like right at that 1 month mark, like we were talking about. So having those elbows bent just decreases that intensity. And then this one here, Rachel is doing the same, another pec stretch, but she's standing into a doorway. So she's got her arms down by her side and she's only pushing as much as she can tolerate. So she's kind of leaning forward. And with both of these, you only want to really hold it for about 15 seconds or so, especially if it's your first time. I don't want you going in for like a minute long stretch right away because we don't want it to overdo it. All right, let's see. All right, so this slide is a little busy here, but bear with me. So this is kind of the later postoperative exercises. So these are where you can increase your intensity just a little bit. Again, make sure you've been cleared by your doctor to kind of start some strength training for that upper body. So early on, usually they say you can incorporate lower body exercises whenever you're cleared by your doctor. So make sure you're able to do those squats and everything without pulling on your shoulder and your pecs. So if you feel like that's straining it, maybe talk to your doctor or a physical therapist about other ways to do this. But you want to be cleared by your doctor, obviously, to do any strength training for your upper body. So generally that's around 3 to 4 months post-op. So some specific exercises that I like to do for strengthening are just your general bicep curls, because this isn't taking you far out of that range of motion that's in by your chest. So some bicep curls, bent over rows. You can bend over on a chair or a bench and row. This is that shoulder blade squeeze movement as well. And then standing rows. So you can take a resistance band and kind of pull back again with that shoulder blade squeeze. Same thing with shoulder extensions, arms by your side. And these are all pictures and videos that I can send you personally if these are something that you're really interested in, but these are just some examples that I really like to do. Overhead press is going to be a little bit more intense. So again, with most of these, I would start trying them with super light weight or no weight at all, just to make sure you can do the range of motion without a lot of compensation, because we don't want to have neck pain or any increased symptoms from doing some exercises, because the ultimate goal is obviously to get you back to moving and kind of getting your shoulder stronger so that we don't have any injuries down the line. There's also some rotator cuff strengthening. So in this right one here, she's kind of taking her elbows by her side, but she's pulling out. So this one's again that shoulder blade strengthening and rotator cuff exercises. And then another one, tricep extensions. And then at the bottom, that picture, it looks funny, but the sword is a fun exercise, but you just take a TheraBand and pull it up. Again, wanting to make sure that you have the full shoulder range of motion before you do most of these, because we don't want to push through any restrictions to get to that point. You want to make sure that that range of motion is there. And then at the end, we kind of talked about some mobility exercises. So any movement of your upper back, like whether it's rotations or any extensions, those are going to be a little later on, but I have a lot of times where I'll take the foam roll and put protect your neck and kind of extend over the foam roll. That kind of gives you a little bit more of a counter stretch. Pec stretching, we talked about kind of on the foam roll or in a doorway, and then general foam rolling of your back, shoulders, low back, anywhere you're feeling stress or tension. All right. So we talked a little bit about the last phase is return to sport or your daily activities, and everybody's activity looks very different. So we've got somebody in the middle, we've got them walking, we've got the top left. It looks like she's preparing to go swimming, but it doesn't look like, I don't know. She's doing some exercises by the pool or the beach. It looks fun. And then you got somebody doing some CrossFit level exercises, yoga. And again, I was mentioning earlier your goals. Make sure you know, kind of you have a goal in mind of what you want to be able to do, whether it's literally reaching the cabinet, the plates in the cabinet. That is a big goal. It's something that a lot of people don't realize when you don't have any prior injuries. You're like, I could reach a cabinet, no problem. But it can take a little while after surgery to kind of get back to that. So that's a good goal to have early on. And kind of, like we said, kind of progress your goals as you go forward. Kind of change them as you change too. Also, make sure that you are giving yourself grace over time. You guys, you have gone through so much to get to where you are right now, and it's a long road. And so everybody's road looks different. It's so easy to compare yourself to the person next to you and anybody else at the pink house or something, but make sure to know that you are on your own path. And as long as you've got some good supporters and people on your side along the way, you can get back to whatever you want to do, whether it's something new you haven't done, but it's a big goal of yours that you've always wanted to do. Go for it, but give yourself some grace along the way. And then this is just kind of the last slide here, just talks about, this is what people think on the left there, what you think that your recovery is going to be like. You kind of start at the bottom, post-op, and you're going to go straight up. But in reality, it looks a lot like this over here. You've got it twisting and turning all different directions. Some days might be tired. Some days you might be in more pain than others. Some days you might be not feeling it, or some days you might be killing it and going way above like your head in that shoulder range of motion right away. And sometimes you just got to remember that it's going to go in a little crazy loop-de-loop before it can get all the way to the top of fully recovered, because it does take a while and everybody's journey is different. Just know that it's not just a linear path all the time. So that's pretty much all I've got for you. I kind of left some time so that we can kind of talk about any questions you guys have. I know we talked a little bit at the beginning, but any questions you guys have for me as a physical therapist here in Charlotte, or any questions you have about surgery, post-op, anything like that, or just want to kind of share your story, let me know.
Shelby, I have a question. How often should we do, how many repetitions should we do of those early post-op ones, the table slide?
Mm-hmm. So I would probably do around 8 to 10 repetitions your first time. Make sure to note with those table slides specifically, don't go as far as you can the first time, because it's actually harder coming back than you think. So just kind of take it slow and steady initially, but about 8 to 10 repetitions and 1 to 2 sets. Don't do too many right away. And then you want, as it becomes easier, go a little further, lean into it. And after probably 2 weeks of doing it and feeling good with it, no pain, you can hold it there at the end for a little while, maybe about 10 seconds or so, and then pull it back. But yeah, 8 to 10 reps. And then the same one, the one with the stick here, also 8 to 10 repetitions, just making sure, again, along the way, pain-free, and just go to where you can tolerate. If it's here, totally fine. Just bring it back down slowly, and just go to where you're feeling tolerated, or where you can tolerate. So that one, 8 to 10 reps around 1 to 2 sets. If the first set of 8 feels great and you want to go for it again, go for it again for another set. But just also take note how you feel the next day. I don't want you to do these every single day, because early on, I want you to note how you feel the following day after trying these exercises. So say you do the table slides, the stick one, and kind of the shoulder blade squeezes, just those 4 right away. The take note on how you feel the next day. If you're so sore or like super like spasmy in the muscles or just feeling really, really tired in your shoulder, take note of that and don't do it that day and take a break. And it might just have been too much. So maybe back it down to 1 set next time.
Okay, thank
Good
you.
question. Yeah.
Shelby, I had two quick questions here. Okay.
Mhm.
Should I pursue or do anything differently? I not only had the mastectomy, but I also opted for the reconstruction. So, you know, should I consider or do some things differently? And then the second thing is, I did notice there are some massage therapists that specialize in lymphatic, right? Would you are what's your thoughts? Should you, obviously I want to start with the PT first, but if the PT clears me, is that an option too, the massage therapist or okay.
Yes. So I'll start on the first question. So with the reconstruction, generally you and that might be why you have your drainage pump a little longer. Would you think, did your doctor say that's why?
They didn't. No, they just said my body's
Okay.
producing a lot, right? Yeah. So
Okay. It could be that I guess they don't know, but that is normal. And I would say definitely take note on how you feel. Once you're cleared by your doctor, you should be good to still see a physical therapist with all of these. You will be a little bit more restricted early on, just with did they do an expander or anything like that?
yes, they did. Yes.
Okay. How long did you have that?
Well, that my surgery is on the 18th of April, so I've had them about a month.
Okay.
Okay.
Okay. So I would say definitely it'll probably be a couple more weeks till you start doing these exercises, the early ones, once they clear you, but you shouldn't have any specific restrictions with that. Just be careful because it might be a little bit slower of a progress, and that's totally fine. Again,
Sure.
just take note with how you're feeling. Don't push through it because you don't want to like break up any of that scar tissue or any of that in the incisions per se. Definitely too, I didn't mention this in the PowerPoint, but with the incisions with both of your surgeries, make sure they are clean and clear and closed completely before beginning like anything overhead.
Okay. Very.
Yep. And then now I lost my train of thought. The second question was
Lymphatic.
the massage.
Yeah.
Yes. So I would recommend starting with a physical therapist. Occupational therapists also can be certified in lymphatic drainage or lymphedema as well. So a lot of times too, there is specific like sleeves that you can get for, and a lot of occupational therapists can measure you and get you fitted for like sleeves for it specifically. So I would talk to either an occupational therapist or physical therapist that is specialized in that first. And then more of a massage therapy approach would be more of like a maintenance and kind of improving that. Whereas the bandage or the sleeves would be more of like an all day thing that you would have. So I would recommend starting with a PT and OT for the first couple weeks. And if they're like, I think you really need a longer hands-on approach, then the massage therapist would be something to recommend.
Okay. Okay, great. And
Yeah.
most people, do they also have in the office an OT as well, or they could at least refer you to one?
Yes, usually they have someone they can refer you to, or in the office. I know I was at Ortho Carolina before where I'm at now, and they did have OTs there as well. Where I am, there's just physical therapists. So I would again call and don't hesitate to ask any and all questions on the phone. Whoever's answering the phone should know all the answers to your question. If not, they'll hopefully find somebody that does. But I would say definitely whenever you're calling for physical therapists, make sure you find someone that does hands-on manual therapy. I thought that was something that most everybody does, but since doing some research and figuring out most people in Charlotte just kind of like want to get you moving, doing exercises and get you out of there. So make sure you find somebody that will spend some time with you one-on-one. That's also another thing. Make sure it's one-on-one, especially because you want that care to be specialized to you.
Right.
I worked at a practice when I lived in Raleigh that I was treating 2 or 3 patients at a time, and there's no way I was giving the optimal care to every single person. So I know that's how I work. And if I were a patient, I would want that one-on-one care as well, especially in your situation. So definitely call and ask if they see one-on-one physical therapy to physical therapist to patient ratio, and then if they do hands-on manual therapy.
Got it. Okay.
Yeah.
Thank you.
I started out with the lumpectomy. They thought that was going to be good
Mhm.
enough. So I had the lumpectomy. Um, when they did the lumpectomy, unfortunately, they neglected to take the cancer out.
Mm.
so,
Oh,
so
Dear.
they so they had to go back in to actually get the cancer, and then and they had to remove some additional lymph nodes. So as a result of that, I started having a lot of side effects of the treatment of having those 2 surgeries. So the
mhm.
lymphedema set in, and then the breast just would not heal. It
Oh,
just, after that lumpectomy, I mean, it was a year and that breast still wouldn't heal. So I had to eventually have the mastectomy, but I did opt for flat closure. I'm not going to get reconstruction, but it
mhm.
still was just I said all that to say that yes, they have occupational therapists at the Levine Cancer Center. They're the ones that helped me with the lymphedema the first go around with the lumpectomy, and they did fit me with a sleeve, and I also have a pump that
Oh,
Oh,
I
good.
like, one of the lymphedema pumps you get into, and it massages your arm, because that's where my lymphedema was. My arm got really swollen.
Uh-huh.
And so for the drainage, they got me a pump it's like a space age bodysuit that just kind of massages my body and kind of does the lymphatic drainage for me.
Yeah, does
So
it go like here, 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 kind of move
yeah,
up?
yeah, it does. I haven't been able to use it since I had the mastectomy. So
Mhm.
I have to wait a while before I can start using it again. But
Yeah,
my arm is a little swollen right now, but it's not nearly like it was after I had that lumpectomy. I kind of wish I just had a mastectomy and did reconstruction in the beginning instead of
right.
doing a lumpectomy. But hey, hindsight is 2020.
it
Yeah,
is.
you never know. Yeah, you never know how it'll go.
Right.
Oh goodness. Well, I do love those compression sleeves for lymphedema. There's this brand called Normatec that they actually started. I didn't realize this. We were using it on a patient with lymphedema that I was like, oh my gosh, this is a game changer. And then I researched more about the actual sleeve, and it started for patients with lymphedema. It's specifically now, a lot of times there's the leg pumps that are used for athletes after recovery, but specifically started out for the arms, for breast cancer and just lymphedema in general. So they work really well.
Yeah, they do. I haven't been able to wear the again yet either because it pulls.
Uh-huh.
But once I heal, I'll be back to do that. Do you know anything about this bandage? They tell you that they put this bandage on you and they said it's gonna come off on its own. It's not coming off on its it's
What does it
not
look
coming
like?
off.
Is it is it a big white one?
It's like it's clear, really. It's like almost clear, like a almost it's thin like gauze, you know what I mean?
Mm-hmm.
But
And it's been on since surgery?
yeah, it's not coming off on its own. They said it'll come off on its own, but it's not.
It's not, and it's been almost 4 weeks. Is it waterproof?
It is. It's
Is
waterproof.
it like totally closed? Go ahead.
I'm wondering if I should use oil, or maybe I'll just ask my doctor because I'm like, it's not coming.
Yeah, usually about 4 weeks it starts to come off, or they take it off for you. Nancy, do you have one of those?
I don't know.
Okay. I would message or call your doctor and just say, hey, this is something that I've noticed is still there. The main thing, you just don't want it to trap any fluid. I know it's waterproof, but if there was any water that got in there, you don't want to cause like any like fluid buildup and like infection on the incision. That'll
Yeah,
be the
so
only
that's what
thing.
I do. Then I'll send them a message and say, hey guys, this bandage is not coming off.
Yeah, and if they're like, it's fine, it should stay on, then just say, when can I take it off if it hasn't come off by this point?
Yeah, because
Yeah.
it's definitely waterproof. I mean,
Mhm.
they did a
Good.
real good job of stitching me up. It's
Good.
nothing
Good.
moves.
Yeah. Yeah. That's good. That's good. Yeah, and another thing I don't think I mentioned is some scar mobility is another thing that physical therapists can help with. So a lot
Oh,
of times just with
great.
any surgery, with any surgery, there's scarring on the outside, right where you have your scar. And internally, there's a lot of scarring too. So what we like to do is kind of do some hands-on kind of like you go cross, it's called cross friction massage. So you kind of work against the grain of it. Again, I wouldn't do this yourself. I would have somebody help you out with that because it can just be hard to do, or they can just at least teach you how to do it in person. Um, just because of where it is and everything, you might want to do it to yourself.
Oh,
It's
that's
whatever.
painful, isn't it?
It feels funky. Sometimes people are still numb there after
Yeah.
surgery for a little while. So, I mean, I've had people after some surgeries, they're still numb for 2 or 3 months around the incision because they've cut through teeny tiny nerve endings. So, sometimes people can be numb for a little while around there. So, you don't really feel it when they work through it, but it's just a weird, some people say it's like an icky feeling. I don't know.
Oh, okay. Because right now I'm having like it's a icky feeling in like my chest muscles. Because
Hmm.
I don't know how I mean, when they removed the breast, I guess they took that skin and just, but they had to add muscle back there, right?
So they usually get it, the muscles underneath all of this area. So it's
Okay.
they tightened it up kind of right on top of the muscle. So
Okay.
I'm I'm guessing the muscle just has not been moved because of where the incision and everything is. So it feels really tight.
It
If you take like
does.
a really deep breath, do you feel like some restriction?
Yeah,
Yeah, so
it
that's
does.
even a very simple first exercise I have people do right after surgery is just take deep breaths because where your ribs line up and where the incisions are or where they've kind of impacted during surgery, your ribs don't move as much. They're supposed to open and close when you inhale. They should
Hmm.
expand and exhale, contract. So, and actually your pecs run right along there, right along the rib cage. So just breathing deep breaths can help kind of give it some like a light stretch to those muscles there and start some light movement there and can help with like not feeling super tight in your chest.
Oh, good. Okay, because I was afraid to do anything because it feels weird. Like when I would breathe in
Mm-hmm.
deeply, I was like, "Oh Lord, I'm tearing it up." It's
Yeah. No, and especially at this stage that you're in right now, it's like a month out. You should be able to just breathe and it's not gonna tear anything up. Sometimes like day of, it might feel a little bit more restricted with breathing, but you want to be able to take that deep breath without feeling like something's punching you in the chest, which can happen initially. So take that deep breath, start light, and make sure you're actually taking in oxygen and don't pass out, please. I've had people do it, so just to say.
Okay.
Yes. So definitely that's a good one, and that can help just expand the chest. And so those exercises where you're laying on a towel or a foam roll can also kind of stretch those pecs too. And as you move your arm more, just even, daily picking up a water bottle, anything like that, you're moving the pec muscles and the rotator cuff and all of that just to kind of start getting it activated.
Okay.
Good.
Thank you. Thank you.
Of
This is
course.
very helpful.
I'm so glad. And there's my email there, Shelby at cltfullcirclept.com. We are located in the Dilworth area. So I recommend if people are close by to come stop in and say hey. And if you have any further questions, you want to just email me. I can always answer some, send you a couple exercises that I would recommend too. I'm happy to help. We are a one-on-one practice in Dilworth. We have private treatment rooms, which I didn't realize was something that I needed in my life. Like I said, in Raleigh, worked with patients, sometimes 2 and 3 patients at a time, and it was a big, big gym, and just wasn't very private. And so I was working on quite a few breast cancer survivors there. And, it's a lot of people have personal stories, and you don't want to share that in a big gym. So I'm really thankful we have private treatment rooms where I am, and just kind of be able to patients tell their full story, and you can really kind of help patients and people feel like they can really get better if you know the full story. So that's one thing I found was really helpful, was just to have private treatment rooms. So that's another thing to look out for when you're looking for a physical therapist or occupational therapist, just to ask if they have private rooms, or treat one-on-one, like we were saying, because those things, they're available, they're out there, you don't have to settle.
Okay. Thank you.
Good. All right. Well, it's nice meeting you guys. And like I said, please feel free to email me if you have any questions. And thank you for attending.